Hi guys, it's Kim. Welcome back to my channel. As promised in my introductory video, I am going to talk to you guys about how I became addicted to opioids and my journey into my opioid addiction and my recovery. So as I mentioned, I'm 36 years old. I started my addiction somewhere between the ages of 21 and 23, I believe. My first time using opioids was when I was around 15. I tore my ACL. It was a sports injury and had reconstructive surgery. And I believe I was given Tylenol with codeine, so nothing too strong, but I didn't abuse it. I think I probably only took it for a day or two, and at that point I was a minor, so I'm pretty sure somebody probably monitored my intake and only gave it to me when I needed it. All I know is that it wasn't an issue at that point. When I was, I want to say 21 or 22, I was working in a very physically demanding job and I hurt my back. I think I had just strained a muscle, but if you've ever done that, you know how painful it can be. And I went to urgent care and I was given my first prescription for hydrocodone. I remember I was in a lot of pain, and not only did the pain pills alleviate a lot of that pain, but I felt really good. The only way that I can describe it is to say that it gave me the warm fuzzies, and that's how I described the feeling for my entire addiction, was the warm fuzzies. I felt very safe, very cozy, and I felt social. I've always been a little, I don't want to say antisocial. I enjoy alone time. I have friends and I like people, but I enjoy being alone. And these pills at the beginning made me feel very social. I wanted to engage with people in a way that I hadn't before. So I finished that course of pills, and I don't think that I took anything else for a while. I'm not entirely sure how long. There's one thing that I want to mention before I get any further in this video. I mentioned to you guys in my introductory video that I have anxiety, OCD, dysthymia. Part of my anxiety or depression is that I disassociate, and I tend to do that very, very frequently. And whether that's the cause or not, I have a very bad memory. A lot of that is due to some things that happened in my childhood, but I've also had struggles with my memory as an adult. And I think that that's because I disassociate. But I just want to let you guys know that, because there are stretches of time that I have no memory of. And so my story here might not quite be linear, but I'm going to do the best that I can. So as I said, I probably didn't immediately go from that script to another. I'm sure that there was some sort of period of time in between there. But at some point in the somewhat near future to that, I was prescribed hydrocodone again. There was a time period where I was having a lot of medical procedures, whether I was having INDs or I had my wisdom teeth out, different things like that, where I was prescribed hydrocodone. So it got to the point where I would start seeking out the medication on a more regular basis. At the beginning, I don't think that I ever lied about anything, but I absolutely exaggerated my pain to get medication. So I would go to urgent care. My back hurts, my knee hurts, whatever. I have an infected tooth or something, and I would get a prescription. And I would do that. I would take all the pills, and then a few weeks later to a few months later, I would go back and try to get more. Eventually, I started having a lot of chronic pain with my knee, the knee that I'd had the reconstructive surgery on. And this was not made up. This was legitimate. I had very severe pain in my leg. It got to the point where I was calling out of work a lot because of it. I just couldn't be on my feet that much. I was actually supposed to have exploratory surgery, which that's a whole nother story. That never happened. But keep in mind, I was also very, very overweight, which did not help. That wasn't the entire cause of my pain, but it absolutely did not help. Anyway, one of my doctors at the time, after trying various other medications initiated me on ongoing opioid therapy. I was put on 5 milligram hydrocodone. Eventually that progressed to 10, 325 of hydrocodone. And at that point, this was before hydrocodone had been reclassified from a Schedule 3 to a Schedule 2. So you could, I don't really know the logistics of everything, but I know I used to be able to get a lot more when the guidelines weren't quite as strict as they are now. But I always took more than I was supposed to. Now, the one saving grace that I've had in my life, well, I've had many, but in this particular situation is that I've always been very paranoid of health-related things, so I never got into like hard drugs, or I never took an exorbitant amount of my opioids because I was always too scared of what could happen. I was scared of overdose. I was scared of side effects, things like that. So while I did take more than I was prescribed, and while I was absolutely abusing them, I never took, I want to say in the height of my addiction, I would maybe take at the most maybe 120 milligrams a day of hydrocodone. So a lot more than I should, but a lot less than a lot of people. I don't think it's right to compare addiction. You know, addiction is addiction, whether you're, you know, doing heroin every day or you're doing hydrocodone. Obviously, it's harder to come off of when you're taking stronger drugs, yada, yada, yada. But addiction is addiction. And when it gets to the point where your entire life revolves around your use, then it's a problem. You know, I had these very strict routines that I would have to follow. I could not deviate from these routines without it just messing up my whole life. You know, I did maintain full-time employment through most of my active addiction. I started and graduated with a bachelor's degree in psychology during my active addiction. So I was what you would call a functioning addict. But that's not to say that it didn't interfere with every aspect of my life. I couldn't make a lot of plans socially. I would go to work, and I would call out sick from work a lot too, because sometimes I just wanted to stay home and take pills, or I would run out and be in withdrawal and I couldn't go to work in withdrawal. So I would miss a lot of work. But I didn't really have much of a life outside of taking my pills. I did the bare minimum of what I needed to do to be a functioning adult, and that was about it. Now, because I would take too many pills every month, I would run out early every month. And I would bargain with myself. If I'm going to take too many now, I'm going to have to take less at the end of the month, and that never worked. If I had them, I took them, and I said, I will worry about it tomorrow. I'll figure out how to get more tomorrow. And sometimes I was able to get more from various reasons that I'm not going to go into on here. But a lot of the time I wasn't, and I would end up needing to go through withdrawal. Now, typically I would go through withdrawal for 1 to 2 days at the end of every month, which isn't horrible, but obviously it's not fun. And again, because I was only on hydrocodone, I don't want to minimize my addiction, but I know that the withdrawal would have been a lot worse had I been on something heavier. That said, I still couldn't function to go to work during that withdrawal. A lot of it was psychological, yes, and that's the case in many individuals' withdrawals, but you just can't get out of bed. You just can't get out of bed when you're going through withdrawal like that. I mean, it takes like every ounce of strength you have to get out of bed. I hated it. And the fear of withdrawal was almost worse than the actual withdrawal. So it got to the point where I was just so sick of this cycle, this never-ending cycle of, you know, and I was obsessive about counting my pills. I had to count my pills every single day. Sometimes every single time I dosed, I would have to count them. Number one, to make sure nobody dipped into them. And number two, so I could figure out exactly how many I could take, when I would have to start weaning down, which again, I never stuck to. I mean, I would even sometimes give my pills to a trusted family member and say, okay, I can have this many pills tomorrow, this many pills the day after. And it would never work out because I would always go over and say, nope, I'm taking them back. I want them back. And then I would take them all. So the last time my last month using, which was October of 2019, I was going to have to go 3 to 4 days in withdrawal before I was able to refill. And, you know, you always feel like your fate is in somebody else's hands, whether that's whoever is prescribing you the medication or the pharmacy. And my pharmacy, like sometimes it really depended on who it works. Sometimes they were like, oh yeah, we'll refill for you on the 28th day. And sometimes they're like, no, you have to wait exactly 30 days. And if you get a really stickler pharmacist, you have to wait 31 days. So you always feel like your fate is in somebody else's hands. And I just was so sick of it. And I had begun researching treatment centers near me. You know, I had researched rehab, which wasn't an option. I didn't feel it was an option. I didn't want to do rehab. I didn't want to do inpatient rehab. I was terrified of it. And it wasn't the help that I was terrified of, but I've always been somebody who, like, the thought of being away from home, wherever my home is at the time, terrifies me. When I was a kid, I'd always have to call my mom to come pick me up when I would have sleepovers at friends' houses, things like that. But I had found out that there was a program local to me through an emergency department where it's called a bridge program, and they would initiate you on Suboxone treatment, and they would prescribe it to you for a temporary period of time until you're able to get in to some sort of treatment center to prescribe to you on a regular basis. So I always kind of had that in the back of my head, you know, and I was also always worried about getting cut off. Like, what if my provider calls me in for a pill count or something like that, and then I get cut off? And it was always in the back of my head that I could go into this bridge program and get on Suboxone. So like I said, this last time I knew I was going to have to go 3 to 4 days, and I was terrified. I was absolutely terrified. And my mom, she wanted to go check out this clubhouse local to me, and it's basically just a place for people to go hang out, people who are in recovery, people who want to get clean. They host all kinds of different meetings there, AA, NA, refuge recovery, things like that. And it's just a clubhouse. It's a place to hang out. It's a place to get support. And my mom wanted to go there for a completely different reason. She does some not-for-profit stuff, and was looking to partner up with somebody. It's a long story. I'm not going to get into it, but she had other reasons for wanting to go there. And she said, you know what, maybe we can find some resources for you while we're there. Obviously I'm like in the midst of withdrawal. I don't want to go, but at the same time, I just had this feeling like this time was different. This time I had to go. Anything but going through 4 days of withdrawal. I have to go see if they can help me. So we went in there. Obviously, I look like crap. I'm sweating. The people, I'm sure every single person in that clubhouse knew exactly what I was going through at the moment just from looking at me. I ended up, obviously, I was always very short-tempered when I was in withdrawal. I could not tolerate just about anything. So we were in there for like 5 minutes, and I was like, all right, I gotta go. We gotta get out of here. So my mom's like, all right. So we go to leave, and we get like around the block into her car, and this lady who had been in there starts chasing us down the street. She's like, hey, like, I didn't get a chance to talk to you. And she was kind of talking to my mom, but looking at me over in the passenger seat. And she's like, you know, I don't want to overstep my bounds here, but it's pretty clear to me that you're in crisis right now, and you're going through some sort of withdrawal. And I just want to let you know that if you need help is available for you today. She said there's this amazing treatment facility literally around the block, which I hadn't heard of this place. I'd never heard of it. And she said, I'm telling you, just go there right now, walk in the door, ask for so-and-so, and they will help you today. They will get you the help that you need today. I promise you. So my mom and I went, we thought, what do we have to lose? So walked in the front door, and it just so happened that the person she was talking about, who she only gave me her first name, so I didn't know, but when I walked in the door, I knew who it was. She's was somebody that I used to work with. And so I felt comforted just knowing when I walked in, okay, there's somebody here that I know, there's somebody here who I know is not going to judge me and who's on my side, kind of thing. So anyway, they got us in within like 5 or 10 minutes, and they gave me like a consultation, whatever, with one of their therapists, and they said, okay, we're gonna get you into our program. We're gonna get you help. We do have a provider here that prescribes Suboxone. However, she's pretty booked up. We're not going to be able to get you in with her for a month or two. So your best bet is to go to that emergency department today, get initiated on Suboxone, and we'll get you set up with treatment here this week, and we'll get you in with our Suboxone provider as soon as we can. So my mom and I headed over to that emergency department. That was a little bit of a cluster because the person in the triage area apparently had never heard of this program before. So I got on their website, and I'm like, here, like it says right here that you have it available. And she's like, well, I'm gonna go page this provider and see what they say. So they put us in like a triage room off to the side. We weren't even in the emergency department proper. And they said, oh, okay, yep, I guess we do have this program. Well, I didn't know about it. So I see a nurse practitioner who worked in the addiction unit, whatever, who was worked in this bridge program. She assessed me. She gave me an evaluation, and she said, I do think that you're a good candidate for Suboxone therapy. I am going to talk a little bit about the dosages here, which I wasn't going to do, but I think it's important because one of my fears going into Suboxone treatment was that it was going to be too strong for me because Suboxone works a lot differently. It's a partial opioid agonist. It works much differently than most of your opioid pain medication, and you can't really compare it dosage wise to other opioids, but I was concerned that it was going to be too strong for me. And I let her know that, and she said, well, the doses are pretty similar across the board, whether you're a heroin addict or a hydrocodone addict. I was worried about this. I've taken oxycodone, I've taken morphine, I've taken OxyContin, but I've never done heroin. I've never taken Dilaudid, anything like that. So I was worried about the Suboxone being too strong. She prescribed me 8 milligram strips once a day. However, I didn't dose right there in the emergency department because she didn't think that my COWS score was high enough. Now, part of that is that I'm very good at hiding any sort of physical symptoms. I had goosebumps, that much was obvious, but I wasn't, I guess, visually in distress enough for her. But again, I've always been really good at hiding that kind of thing. So I knew that I was in enough withdrawal. Now, if you don't know what I'm talking about, because of the way that Suboxone acts on your receptors, if you take it when you have any opioid, any full agonist opioid in your body attached to your opioid receptors, it will put you into immediate precipitated withdrawal. And the withdrawal will be a lot worse than your normal withdrawal. So you cannot take it unless you have a COWS score at a certain, basically you can't take it unless you're in moderate withdrawal. And that's going to depend on your whatever drug you regularly take, whether it's instant release, extended release, yada, yada, yada. I knew that I was in enough withdrawal to take it and be okay, but she wasn't so sure. So she said, I'm going to give it to you. I want you to wait a couple of hours if you can. But she said, take the whole 8 milligram strip. So we got home. I waited a couple more hours just to be sure. And I did not want to, I was not comfortable taking 8 milligrams. So I cut it in quarters. So my first dose was 2 milligrams. Now, I've talked to a lot of people, and for some reason, and I don't know if this has to do with the fact that I've had weight loss surgery. I don't think so, because Suboxone is sublingual. So it doesn't really, your stomach and your intestines shouldn't really have any effect on the absorption. So I don't know why this is, but for some reason it takes a little bit longer for, number one, for it to dissolve in my mouth, and number two, for me to feel the effects of it. So it took a while. But once it finally kicked in, I was high as a kite. Higher than I'd been in years. High as a kite. And part of me was like, this is great. But the other part of me was like, how is this going to help me get better? How is this going to help me get clean when I'm high? You know? And thank God I didn't take all 8 milligrams. You know, thank God, because I cannot imagine what I would have felt like. There's absolutely such a thing as being too high. Absolutely, because I've been there and it's not fun. It doesn't feel good. So throughout the next week, I ended up having to take over a week off of work because I had a very hard time adjusting to the Suboxone. I ended up going lower than 2 milligrams. I can't remember. I think I was taking as close to 1 milligram as I could. Obviously, they were 8 milligram strips, so it was hard to cut them evenly to know what dose I was getting. But I think I was somewhere around 1 milligram. Now, it wasn't, I just felt sick. The only way that I could describe it is I felt like more car sick than I've ever felt in my whole life. But in another sense, I was still having cravings. So I knew that I knew that I wasn't taking enough to curb my cravings, but I was feeling sick. Now, I never felt high like I did after that first dose. So I don't want people to think that you can just take Suboxone and get high. Obviously it can happen, but that's not the goal of treatment, and I'll get more into that later. But that was just really that first dose that made me feel like that. So to try to make a very long story a little bit shorter, I had to wait for my body to get used to the medication, doing just that 1 milligram. I think I was doing 1 milligram once or 2 to 3 times a day throughout the day to get my body used to it. I went back to the provider and she was like, yeah, you know, you got to do what you got to do. She's like, I've never heard of it affecting somebody like this before physically. So eventually my body got used to it, but I was still having a lot of cravings. So I went up to 2 milligrams. But I was doing 2 milligrams twice a day. And again, my provider was aware of this. She was the one who said, because you're not taking all 8 milligrams, she goes, you go ahead and do it twice a day if that helps you. If you need to take smaller doses more often, she said that's fine. So I continued to see that bridge provider until I was able to get in full time with my regular provider. My dosage did get changed a few times. Again, once my body was used to it, I would start getting cravings again, really, really severe cravings. I stabilized at 4 milligrams twice a day. And that I've been stable on that dose for quite some time now. I still have some psychological cravings, but I don't have any physical cravings. And those are normal, and those are things that you need to deal with in treatment. So let's see. I totally just lost track of where I was going with this. So I got into my permanent or more permanent treatment center. They kind of assess you and let you know what kind of treatment modalities they think would be most beneficial for you. My therapist didn't think that I would get that much out of group therapy. She thought that, I don't know, maybe my situation was a little bit different than other people's, but she just thought that I would benefit most from individualized therapy. So that's what I've been doing for the last over a year. And it's been great. It really has been wonderful. Now, I've struggled a lot because I had all these mental health issues, the anxiety, the OCD. I thought my OCD was gone. I thought my OCD was just a temporary thing. And what was happening was that the hydrocodone, the pain pills, were covering it up. I wasn't experiencing OCD when I was on them. So when I got clean, and yes, this is a debate for another day, but I do consider myself clean even though I am on Suboxone. I'm not abusing my medication. I'm not building routines around my medication. I take it as prescribed, and I don't give it another thought until it's time to take it again. So I am clean. You can have another opinion if you want, but nobody can tell me whether I'm clean or not other than me. So I have actually just recently graduated from my treatment center. I'm in now what's called continued care because I'm still on Suboxone. Sorry, the cat wants to eat the pillow. Because I'm still on Suboxone, I still see my provider once a month and I check in with my therapist once a month. That's what's called continued care. I do still need professional help. I still have things from my childhood that I need to deal with. However, I need to seek treatment elsewhere because my treatment facility really is only allowed to address addiction issues, which is funny because obviously addiction it comes from somewhere, you know. Psychologically healthy people don't just turn into addicts, in my opinion. I mean, I think whether it's trauma or whatever else, I think that addiction comes from somewhere, and you want to treat the underlying cause of that addiction in order to treat the addiction. And so I've been trying to look into, I'm not sure, maybe DBT, or I had considered EMDR for a while. We decided that that's not for me, but regardless, nobody is really accepting new patients right now because of COVID around here for like psychological purposes. So I'm kind of in a standstill right now, but I'm doing really well. I have learned to, I'm able to tell when I'm disassociating, which is a lot. I am able to recognize a psychological craving and for the most part can determine why it is that I'm having that craving and deal with it in a healthy way. My therapist tells me that I don't give myself enough credit, and I guess she's right. I know that, you know, we're tougher on ourselves than anybody else is, but I'm just going to say that I'm still struggling with a lot of things, but I do feel that I feel that I've come a long way. There's a long way yet to go, but I feel good about where I'm at. Now, when I first started Suboxone, I told myself that I wanted to begin the weaning process within a year. I am somebody who told myself it's not a forever medication. And that's for me. I'm not talking about anybody else. I can't tell you or anybody else how long you should be on it. That's up to you and your treatment providers. But for me, I don't want to be on it forever. The goal was to use it as a crutch to be able to deal with the underlying issues and the psychological stuff without having to worry about overwhelming physical cravings or psychological cravings, and just be able to breathe for a little while and have one less thing on my shoulders while I deal with the other stuff. But I will tell you that starting treatment with a deadline or a time frame is not a good idea because everybody is different and you don't know when you're going to be ready to wean or to get off of it. You just don't know. I do think that I am at the point where I'm ready to step down to a smaller dose and see how I feel. Again, I'm on 4 milligrams twice a day. I think I'm going to talk to I'm not going to make this decision on my own. It's going to come from my treatment provider, but I think I'm ready to step down. I really do. I don't think that I'm anywhere near ready to be off of it, but I think that I'm ready to step down. So that's going to be the next step. And I really my hope is to connect with other individuals who have suffered with addiction or mental health issues. I do think that it's helpful to share our experiences with one another. And, you know, again, I'm only a little over a year and 3 months clean, but I think part of helping yourself is helping others. And if I could help anybody, even just by listening or being an ear for somebody, I would love to do that. So I'm going to end this video here. If you have any questions, feel free to leave them in the comments below. I will read your comments. I will answer any questions that you have. I'm pretty much an open book. I don't have anything to hide. I really don't, there's nothing, I'm not ashamed of anything. There's nothing I feel like that I'm not willing to share in regard to recovery and addiction and mental health issues. So that said, I'm going to end this video here. I hope to talk to you guys soon, and have a good night. Bye.